Good day, everyone. Again, this is your nurse Edwin. This time, I will be discussing on how to easily understand topics about diabetes. Having diabetes means you have too much sugar called glucose in your blood. So, if untreated, diabetes can harm the body, particularly the heart and vascular system. So, in fact, people with diabetes are 2 to 4 times more likely to have heart disease or suffer a stroke than those who don't have the disease. Experts say the risk is even greater for women with diabetes. Diabetes can lead to heart attacks, strokes, kidney disease, blindness, dental disease, amputations, and other serious health problems. And the longer you have high levels of blood glucose traveling around your body, the more likely you are to have problems. So, you guys, if you have diabetes, the best thing you can do is to learn about how to manage your condition and prevent problems. Now, let's understand about diabetes. Diabetes develops when the body either, number one, does not make enough insulin or is unable to use insulin properly, which also called as insulin resistance, usually or generally the result of being overweight, not exercising, or eating a poor diet, which can lead to metabolic syndrome, or this can be both. Now, let's understand about insulin. Insulin, guys, is a hormone that is usually made in the pancreas. It helps your body use the sugars that are in the foods we eat. Glucose, on the other hand, gives your body energy, and insulin helps carry glucose to your cells. So, if your body doesn't make or use insulin well, glucose builds up in the blood instead of being absorbed by cells in the body. The body's cells are then starved of energy despite high blood glucose levels. Now, let's understand the three different types of diabetes. First, type 1 diabetes. This is also known as the juvenile diabetes, which is usually found in childhood, but not always. Second, type 2 diabetes. This type 2 diabetes is the most common form of diabetes, accounting for up to 95% of all cases. It most often occurs in adults. However, more and more children are being diagnosed nowadays. This may be because more youth are overweight or less physically active. And the third type is gestational diabetes, which occurs during pregnancy. We have to understand, guys, that diabetes is a lifelong condition that needs to be managed to stay healthy. Over time, too much glucose in the blood can cause serious problems, including one, heart disease, stroke, damage to the blood vessel in your eyes, kidneys and nerves damaged to the arteries of the legs that in some cases can lead to loss of a limb, ulcers on the foot or legs that don't heal well, and lastly is the gum disease. There are a number of things that can make someone more likely to develop type 2 diabetes. And what are those? For example, one, being overweight or being obese. You have to remember that the more weight you carry, especially around your midsection, typically the more resistant your body is to insulin. Second, having high blood pressure, usually or generally or during pregnancy, we call it as pre-eclampsia. And the third one is eating an unhealthy diet that is high in fat, calories, cholesterol, and processed food, and not exercising regularly. Another factor is being older than 45 years old, although it can occur in younger people. And another one is being hereditary, rather having a parent, brother, or sister who has diabetes, or being diagnosed with gestational diabetes. Now, understanding what are those signs and symptoms of diabetes. Now, extreme thirst or nauuhaw ka, urinating more than usual, or ihi ka ng ihi, unexplained weight loss or losing weight, wounds or blisters that don't heal well, tingling or numbness in your hands and your feet, feeling tired all the time, dry, itchy skin, red, swollen, tender gums, or even having some frequent infections. Now, how diabetes being diagnosed or how it is diagnosed? Diabetes is diagnosed by taking a detailed medical history, including report of symptoms and blood tests that measure the amount of glucose in the blood and how your body handles it. There are actually several types of blood tests to check your blood sugar. Number one is hemoglobin A1C, or simply A1C. This particular test gives an overall picture of your blood sugar level over the last 2 to 3 months. Fasting blood glucose test. This particular test measures the amount of glucose in your blood after you haven't had anything to eat or drink for 8 hours. And lastly is the oral glucose tolerance test, which checks your blood glucose levels before and 2 hours after you drink a special sweet drink, and shows how well your body processes glucose. Now, how are you going to manage diabetes? Of course, there are a number of things that you can do to help manage your diabetes and live a healthier life. That means having diabetes, that's not the end of the world, in other words. So it's very important to take steps that will help you keep your blood sugar level low. And this is most often achieved through a combination of the following. 1. Healthy eating, exercise, insulin therapy or diabetes medication, routine blood sugar monitoring, diabetes treatments, like regular checking your diabetes or sugar level. Now, you have to remember that when you have diabetes, your aim is to lower your high blood glucose levels and prevent problems such as nerve damage, high blood pressure, issues digesting food or gum disease, and others. So you guys, I hope I was able to help you understand by sharing the basic knowledge about diabetes. Again, that's all for now. This is your nurse, Edwin, saying, have a good day and thank you.